Assalamu alaikum to all. So today we are going to have a webinar or session on what is MRCEM, what is its scope, and then we will also discuss simultaneously how to prepare for the MRCEM primary and how to prepare for the MRCEM SBA. So I will cover all of these in this session. If anyone of your friend want to know about MRCEM, you can share link with them. And if anyone is going for MRCEM primary, they must go through this session. If anyone is going for MRCEM SBA, they also must go through this session. First of all, starting this session, I want to introduce myself, that my name is Dr. Badruman Khizer. Currently, I am working in Saudi Arabia under the Ministry of National Guard. I have completed my MRCEM and I have also done MPhil Public Health, and with that I have also passed the DHA, SMLE, all these exams. So my mentor is Dr. Ishfaq Ahmed here. You all may know him. He is the founder for introducing the MRCEM in Pakistan, and I am also affiliated with his program, London Global Emergency Medicine Program. I am faculty member, international faculty member, instructor of 100 EM procedure workshop at the London Global Emergency Medicine. So London Global Emergency Medicine Program is a 2-year certifications program. I can share it with you about who don't know. The brief introduction for my mentor, Dr. Ishfaq Ahmed. He has done MRCEM, MRCP, MRCPCH recently added, FRCEM, EBM. He is working as a consultant emergency medicine, acute medicine in NHS UK. So he introduced London Global Emergency Medicine back in 2022. So I joined him, and alhamdulillah, I passed my MRCEM in 2 years. That they also give the certification for 2 years. So his dream is to produce 5,000 EM physicians in next 10 years, and that is the dream, and the slogan of Dr. Ash is that every doctor is trainable. And we are the few doctors, we are example of that we have not joined any training program, but alhamdulillah, we are better than many institute trainees. So this is the broadly on them. Yes, non-trainee doctors are fine. So anyone can do MRCEM. Either you are working, either you are not working. Either you are in training, you are non-trainee doctor, you are working in a BHU, anywhere you can do MRCEM. So that's what you must keep in mind. So MRCEM, what is MRCEM? First, you must know MRCEM is the Royal College Emergency Medicine Diploma exam. You can say like MRCP, MRCPCH, or MRCOG, MRCS. After MRCEM, you will also is mute. No. Okay, so commonly question that is being asked that what is our future after MRCEM? So emergency medicine and family medicine, I would say emergency medicine, I will keep above. That is the emerging field, and next 10 years, you will have a lot of jobs, and there is a high demand in Gulf countries. There is also high demand of emergency medicine physician in UK, Ireland. After doing basic exam like lab, people are struggling for job, but after MRCEM, I have not seen a single person who did not get the job in UK. So that's the worth of MRCEM. There are three parts for MRCEM: MRCEM Primary, MRCEM Intermediate, MRCEM SB, or MRCEM OSCE exam. So MRCEM Primary, that is being connected online in all of the cities in Pakistan and in Gulf countries everywhere. You can also appear an exam from home, but I would not recommend in Pakistan due to the internet problem. If you are in a developed country, you can also appear from home if you don't get center. So that's why you don't need to worry about the seats. Tomorrow is the last date for booking of exam if you want to go for it. What is the eligibility criteria? Who can appear in the exam? That's the most common question. If you have a permanent PMDC, either you are going to have a permanent PMDC, if you are from other country, you have the licensing exam, you have done with the house job, you can appear. Either your house job will be completed till the end of September, then you can also appear. You can upload the provincial or provisional PMDC. Then when they will ask, you can upload the permanent PMDC. So you can appear only with the PMDC. If you have PMDC, let's appear in the exam. When it is connected 2 times in a year. Okay. So next date is in October. Tomorrow is the last day to book the exam. And next will be in probably May, April, and then next will be in October, November. So these are the months they are conducting this exam. So 2 times in a year. So first we have talked about who can appear in the exam. Anyone who have permanent PMDC can appear without any experience, without any OET. Do we need OET? No OET required. Okay, nothing required. Only they need, you must people working in emergency. No, you don't need to work in emergency. For MRCEM Primary, MRCEM SBA, you don't need to work in emergency. So you only need permanent PMDC or in your country licensing exam, then you can appear in the MRCEM Primary. After that, the question is asking, yeah, I have booked the exam. How to prepare, what is included in MRCEM Primary. MRCEM Primary is totally on basic sciences. Like it would be anatomy, physiology, pharmacology, microbiology, pathology, evidence-based medicine. Next are the resources. We will talk about the MRCEM Primary. So I will tell about the MRCEM Intermediate. I will finish that. What is MRCEM Intermediate, Primary, OSCE? Then I will tell you that how to prepare for the exam. MRCEM Intermediate. So it is also connecting in Pakistan and other Gulf countries. You can also appear online. This is also online. So first you have to book the exam. You have to pay, and then you can appear. You can book the center. You will get the email for booking the center. If you don't get it, you can also appear from home. But I would not recommend to appear from home for Pakistan because of the internet problem. If anyone who has a fast internet at cafe, you can go there and you can appear from there. But most of the time there are internet problem. If there is any obstruction for a 1 minute, they will cancel your exam. So it's best to go at the center and appear. So it is conducted MRCEM Primary, Intermediate, all the big cities like Multan, Karachi, Islamabad, Lahore, Peshawar. I think nowadays Gujarat, Faisalabad, it is being also conducted. So different. We will talk about that. How should in the MRCEM Intermediate, there is a major trauma, orthopedic trauma, peds emergency, medical emergency, procedure skills. These are the major topic we will discuss in the how to prepare for the MRCEM Intermediate. So that's the MRCEM Intermediate. What is the requirement to application? So for MRCEM Intermediate, they have changed that you need 1 year post house job experience. Okay, always remember it is 1 year post house job. Mean if you have done 1 year house job, so 1 year post job, it can be any experience, GP experience, any type of experience you are working. So, and they will not ask about the certificate of experience. Only you have to mention. If they have a doubt, then they can ask. Either most or 80% chances that they will never ask for the experience certificate and any proof. So you can appear in the exam. But other important thing that people confuse that it is written on the website 2 year post education. So that is post medical education, mean after graduation. It include 1 year house job, 1 year post house job. So total 2 years. Mean post house job 1 year, post education 2 years. So that's the difference between it. So you have to put always when you are filling the form for MRCEM primary, you can put your MRCEM house job year as a experience certificate. So that would be your 1 year experience. Then when you will put after that, you will put so that you can appear for the MRCEM intermediate. Then the MRCEM asks you if you have passed the MRCEM primary and MRCEM intermediate, then you can appear MRCEM. For MRCEM asks you need 6 months emergency experience. Only 6 months emergency experience is required for MRCEM. So total 2 year, post house job 2 year, and 6 months included. So if you will mention in any experience, like if you are working in RHC, if you're working in BHU, so for RHC, BHU, if you will mention that I am working there, so that will be accepted. Okay, so don't worry about the experience. Most of the people ask that should we appear or not, will we need emergency experience. So that's you must know about it. I will ask question answer. Don't worry, I will ask the question at the end. Okay. So that was the overview. Who can appear? MRCEM primary, MRCEM intermediate, and 6 month only emergency experience. You can mention BHU, I am working as emergency. When you have to mention it. RSC, you can mention it, the emergency medicine experience. They will not ask. Most of the time they can ask, but in Pakistan, you can get any experience certificate. So they trust you. So don't worry about the experience or anything. Okay. If you want to go for exam, you must go for it. So where it is connected in India, Malaysia, and London. So India, you must not think of it. So many people have wasted their money for India. You will not get the visa. So you have only 2 options, Malaysia and London. So you will get only 4 diet. So Indian people are lucky that they get 2 extra diet and they appear in their own exam if you are from India. Or in Bangladesh, most of the time, mostly the Bangladeshi people also don't get the visa. So you must think that you will get only 4 times, 4 chances to go for exam. Okay, that was all about MRCEM primary, MRCEM intermediate, who can appear, and what are the requirements, when is the exam is conducted, and what are the requirements. So MRCEM primary, intermediate, I will give a short brief. MRCEM primary, MRCEM intermediate, they are conducted 2 times. MRCOG, that is conducted 6 times, but for Pakistan, you must consider it 4 times. Only Malaysia and London died. 3 London died, and 4 1 Malaysian. Other 2 Indian diets, you will not get the visa. That's why you must not go for it. So next is the worth of MRCEM. MRCEM is recognized as a specialist qualification. In Saudi, UAE, UK, if you have MRCEM and after that you get the GMC, you will be registered as a specialist on the Gulf countries registered, you can be registered. Okay, for UK, you will be also work as a registrar. That is like a specialist. Okay, so that's the worth of MRCAM, and you, if you have IMC, you will get an easy job for the emergency department. So most of the time you will be registered as a specialist in Saudi UAE, but they will ask you to work as a staff physician, as a registrar. Then they can also ask you as a work as a GP for a 2 year. After 2 years, they will make you specialist. That's very important. If you have post MRCAM experience, 2 years post as a registrar in any hospital in Pakistan, India, Bangladesh, then you can come as a specialist post or assistant registrar, assistant consultant, like that, registrar, so that then they will accept Gulf country, they will accept as a specialist. But with MRCAM, you will have a great chances, high chances to secure job on a staff physician as a registrar. So after the 2 years, you can be promoted. So that's why there are a lot of jobs you can get with the MRCAM. Full MRCAM and will open the world. EM for you candidates are welcome. So that's most of the time, if there is a shortage for emergency physician and your CV is good, so you can get the job without OET. But that depends on the trust, if they are accepted or not. But you must go for OET. After that, you will get the GMC. But that's called sponsored GMC. That can, if after MRCAM primary and intermediate, if you are having a training job, if you are working as a registrar or anything in the emergency department, then there are chances with OET, MRCAM primary intermediate, you can get a sponsored GMC. If any trust offers you a job, after that they will request the GMC to give you a license to practice, and that's the pathway you can also choose. So there are high chances. But that's unfortunately from Pakistan, it's very difficult to get this sponsorship job. I have seen people who are in a training, they can get easily, but who are not trainee. So most of the time, because we are in a red list, so recruitment agency, they don't offer such sponsorship program. They don't offer trust, don't offer you sponsorship program, because most of the people from Nigeria, Bangladesh, they get this sponsorship with the help of recruitment agencies. So when I did not get the OSCE seat, I was in contact with the recruitment agent. So he tried to enroll me. He said that your CV is good, but he said your country is in red list. It would be difficult. So that's the reason. But our colleague, Dr. Amir, who was working in Maldives, he got sponsored GMC after MRCAM primary intermediate, although he did not join. And after that, he passed MRCAM OSCE. So that's also the option you can join. Emergency medicine, these are highly paid jobs in UK still now, okay, as compared to other specialties. That's after MRCAM, what can you do? You can join UK National Training Program as ST3 through the DREAM pathway. Always remember that the DREAM pathway. You can join as a registrar, non-training post. After that, you can join the training and you can start the FRCAM. Other thing, if you don't want to go to UK, if you don't want to go to UK, you want to stay in Pakistan, you want to stay in Saudi, Dubai, there are females who mostly ask these questions. We don't want to go Saudi, out of country. We have a limited problems. We have a family problem. We can't go. So after doing MRCAM, you can do FRCAM staying in Pakistan, staying in KSA, staying in UAE. That's called a Caesar pathway. You have to find some FRCAM person and you have to work under him. Like at Shifa, they have FRCAM, and Lahore, there are many hospitals now they are hiring the emergency physician. IMC, I think Slim Memorial Hospital, Central Park, and a lot of hospital, they are hiring MRCAM person as a specialist. So the trend of emergency physicians increasing in Pakistan too. Yeah, after MRCAM, you will get the GMC, but for GMC you may need OET. That you can get without OET GMC. With OET you can also get the GMC. With OET you will get definitely GMC, but without OET, first you have to find the job, then you can get the GMC. So if you are having done lab anyway, you have got the GMC, IMC, you're not getting job, you must go for MRCAM. Yes, only with the primary and intermediate, you will have a high chances to get the job in emergency department as compared to others who are not having MRCAM primary intermediate. So most of the students who are in contact with me, they said that our firm, we did attachment and they have asked if you pass them MRCAM SBA, we will give you the job. So that's the worth of MRCAM. Can anyone can get training? Yeah, if your CV is very strong, like you have got CBD hours, your learning curve, your teaching experience, quips, audits. We will also have some session on CV in future, that how should be your CV, how my CV is looking. So that's very important. Then yeah, you can get the training job. As I would not recommend to directly go for training from Pakistan, but you will struggle it, because you have to understand the system for 6 months to 1 year, then you can train it. Attachment or worth, I would say that there is no worth for attachment. If you are wasting money on attachment after IMC, lab, you must pass the Royal College exam instead of doing the attachment. That's very important. So you must pass the exam instead of attachment. So that was all about MRCAM scope. What is MRCAM? Who can appear the exam? And what's the worth of it? So now we will talk about MRCAM primary, especially MRCAM primary. If you have booked the exam, how you must prepare for the MRCAM primary exam. Okay, for MRCAM primary exam, we have talked about who can appear. If you have permanent PMDC, tomorrow is the last date. You can appear in the exam. It is conducted in all over in Pakistan. Okay, you can also appear from home. So I have a student who appeared from home in Maldives because he was unable to move out of the island. So he was on a resort. So he appeared from there. So the next question is how we should prepare for the MRCAM primary. What is an MRCAM primary? MRCAM primary is completely on basic sciences: anatomy, physiology, pharmacology, 24, microbiology 17, pathology, evidence-based. So first 2 months you can prepare MRCAM primary in 3 to 4 months. Okay. If you have a lot of time, you can also, some people will meet you, they will say that I have passed MRCAM primary in 1 month, 2 months. They will say you, yeah, it depends from person to person. If you are giving 4 months and you are giving only 4 hours, that in 4 months you will give how much time, that depends. You will give 300 hours. If any person is giving 1.5 months on daily, he is giving, a person is giving 8 to 12 hours, that means he is also giving the same time. So that depends from person. If you are a graduate, all graduate, you have not seen the basic sciences from last decades, 2 decades, it would be difficult for you to read again the anatomy, physiology, pharmacology, and retain it. If the person who is graduated recently, who has attempted the MRCAM part 1, any exam, no, he is appearing in the MRCAM primary, he has passed the FCPS part 1, either he has passed any exam, a USMLE. So it will be easy for him to appear in, because he is aware with the basic sciences. So that's varies from person per person, but normally it will take about 3 to 4 months. It depends from on the person how much time he can give. So that's very important. Okay. How should you study? What should you study? You must download this curriculum, MRCEM primary curriculum, and you must follow it. They will not give any question out of it. Okay, for MRCEM primary. So you can see for MRCEM primary here that I have told you there are 60 MCQs from anatomy, 60 from physiology. 60 from MCQs, anatomy mean 9 from upper limb, 9 from lower limb, 8 from thorax, 9 from abdomen, and 9 from head and neck, 8 from central nervous system, 8 from, so total 60. So they will follow it. They will not give that from anatomy, they will not give 61. They will not give 58 MCQs. They will give 60. If they have said 60, so you have to download this file and you have to follow it. You want to study from anywhere, just follow this syllabus. They will not go beyond this syllabus. Okay. But it's being asked, they will give, we will discuss. In the physiology, there will be 60 MCQs. From there are 6 systems. So each system carry equal marks, 10, 10, 10, 10. So that's how you can see from anatomy physiology, there are 120 MCQs. And from pharmacology, there are total 24 MCQs. So these 3 things, they are carrying a weight of 144. That means approximately 70% MCQs, 70% exam will be from these 3 things: anatomy, physiology, and pharmacology. So you have to focus on it for first 2 months, and then after that you can study micro and pathology and EBM. That should be your strategy to study. For 2 months, you just focus on these. So as I am conducting the course, MRCEM primary course, so I start from anatomy, then I do the physiology theory, then I do the pharmacology, then I do the micro. I don't touch the pathology and EBM. So they are 19. So I say to my students, don't touch it. Leave it on me. I will conduct 2 sessions on micro and pathogens, 1 session on pathology, 1 on EBM. That would be sufficient for you to just go through my sessions and you will get maximum marks in these 4. Just focus on anatomy, physiology, and pharmacology. So how much revision you must do, that's important. Most people ask that, how should we prepare? Okay, what are the resources you must use? Resources you can, like in the syllabus, you can see that in the first upper limb, they have asked about the muscle. Surface marking, action, not supply. So they have not mentioned attachment. So you don't need to remember the origin insertion. You must. So some origin insertion is important. There are 2 to 3 muscles in upper limb, like tendons, that are important. That are important as per emergency department. Like if patient is coming with the injury to the hand, so there can be the injury to tendon. So their attachment is very important as like that. So that's why other attachments are other muscle attachment are. So they have asked about surface marking, action, nuts. So you must focus on the anatomy for muscles, action, nut supply, arterial supply. These are very important. Okay. So joints, you can see appreciation their role in producing petrol movements, fact, ACG. So that's very important. Okay, from where, what are the resources you must use? You can study following this syllabus anywhere, any book, anywhere. So if you have studies in the anatomy in the first year from BD, you can go there and you can study. After studying, you have to practice the MCQs from MRCEM success. Okay, so you must practice the MCQs from MRCEM success. So you must know that there will be no MCQs from MRCEM success like people do for Plavable. That no MCQ, but that will give you an idea that how to pick up the MCQs. So as we are conducting a primary course that is about 5 months, 3 months. So I teach theory for every system from A to Z. After that, like we are conducting MRCEM primary, we also provide the recorded lecture. And from September, we will start MCQs based session. So at the end, we will have a 2-day course. So you will get all of these in one go. So you can also follow this, that the study plan I follow. I always say that you must go through the syllabus 3 times. You must go through the syllabus 3 times. One should be the theory, you must make your notes, then the MCQs based, then you must revise it. So then you will confirm pass the exam. Other important thing that people ask, here was the passing marks. Passing mark varies. You must have target that you may get more than 65% in MRCEM primary. That's very important. Okay. So if your target is more than 65, you are 70%, then you are going to pass it, confirm. So they will not ask a weird question. They will ask clinical question. Okay, like they will ask like person 21-year-old who was going on bike, got an accident, he presented to the emergency department. During the examination, SHO noticed that patient is having sensation loss on the little finger. So they have given a clue that is a sensation loss on the little finger. So in the question they will ask what type of nerve they can ask. Either they can ask any function like any muscle that is being supplied by ulnar nerve. So they can ask which what's the other thing that you will find on it. So that's the how the question can be asked. Okay. So like if they have given there is a humerus shaft fracture, they will give the clue that there is a hematoma here. So they can, so you have to pick the nerve, then they will not give that the radial nerve is affected. They will give the where the patient will be having what type of symptoms will be having it, like sensation loss on the dorsum of the hand, lateral side of the hand, loss of extension, wrist extension. So that's how the question can be asked. So that's you must prepare. That's all about the MRCEM primary. If any question about MRCEM primary, okay, I was asking any question. Dr. Nam is asking, yeah, you can get the training, direct training, that's the dream pathway. Either you have to give the MSRA, okay? So MSRA is multiple specialty exam that like part one in Pakistan, you have to give it, then you can get the training for ST1, ST2. That is the general route of training, okay? So for dream pathway, you only need if you have done the MRCEM and there is a criteria
for the dream pathway, you can directly apply without MSR. You don't need MSRA for dream pathway. So they are. So you can also do the FRCAM without going for training. That's also Caesar pathway. You can do it. Only working in emergency department NHS, you can do the FRCAM. Giving, if you have a 4-year experience post MRCAM, total emergency experience 4 years, then you can also prepare for FRCAM SBA from Pakistan. You don't need to go there anywhere. Any other question related MRCAM primary? If anyone who have booked the exam and they want to join us, you can join for MRCAM primary course. We are providing recordings, resources. You only, if you are preparing on its own, there are many, you can go through any lectures, okay, but there would be on the YouTube, there would be lectures related to USMLE, general anatomy, but not the exam oriented. So I don't think there are lectures present exam oriented. So we are conducting MRCAM primary session or preparation only in 30,000. Okay, that's not too much. And you will get the recordings, everything, and the other thing that you will get the offline resources. Like you don't have to buy the PrepXpert anything. You will get it. Any question about MRCAM primary? No, we will move on to MRCAM SBA. Okay, that was all about the MRCAM primary. If you have any confusion, any guidance, so most of the people contact me. We don't charge for guidance. Okay, so we only charge what the time we are giving. Like for teaching, we charge for it. You have to just follow the syllabus. Yeah, it's MRCAM success as per, it is written as per MRCAM RCAM syllabus. But you must remember, no, they have make it difficult. MRCAM primary, people used to pass it with MRCAM success. It depends on you, how the knowledge, background knowledge you are having, how much the gap from the studies, it's all depends on you. If you have a lot of gap, then it would be difficult with the MRCAM success group. But you can pass it. You can pass only following the syllabus, anything, that's what. Okay, next we are going for the MRCAM SBA. That's the most difficult exam, I think. Oh, yeah. So don't follow any other online source. I don't recommend any other source other than MRCAM success. Okay. For MRCAM primary, I'm talking, not about MRCAM SP. MRCAM SP is totally a different game. You don't have to follow one resource. You don't have to follow one resource. Okay. MRCAM SP is different game. For MRCAM primary, for online resource, you only follow the MRCAM success. Nothing to. You can find PrepXpert quizzes. It's too expensive. You can take the offline quizzes. Okay. Don't go for it. You can also follow my recalls file. That's also very important. Okay, next is the MRCAM SBA. That's the very people ask about it. That how should we prepare? MRCAM SBA. So there are also 180 MCQs like MRCAM primary. So for MRCAM primary, you will get the 3 hours. That's enough time. For MRCAM SBA, you will get 4 hours. So that would be in 90 MCQs. Okay, 90 and 90 MCQs.
So first 2 hours you have to attempt the paper 1. Then for next 2 hours you have to attempt the paper 2. There will be 1 hour break in middle. So there it is connected at the Pearson Wu centers in different cities of Pakistan, Gulf countries. In the world, there is a list of countries where this exam is being conducted and cities you can go through it. So in Pakistan, same like MRCEM Primary, Karachi, Lahore, Islamabad, Peshawar, Multan, Faisalabad, all the big cities, it is being conducted. So there are no seat limits like MRCEM Primary. Anyone can appear. First, you have to book the seat, and then you can book the exam. And after that, you will get the email for center booking. That's what all about. So there would be all type of question, full range of condition presentation that would be encountered the ED, that you have to follow the syllabus. So last attempt, it have been finished, you can't book. The next exam would be approximately in 2026, January or February, okay? That depends on them. The 2 times exam is being conducted, mostly in January, February, March, either in the September, October. So these are the dates for MRCEM, SBA exam or intermediate. So you have to follow syllabus, but its syllabus is not defined, well defined as compared to MRCEM Primary. That's the most difficult thing that is people are facing in MRCEM SP exam. Like that's the specialty learning outcome, SLO1, SLO3, SLO4, SLO5, SLO6, SLO7. So these are from SLO1, there would be 60 MCQs. From SLO3, that is resuscitation. That includes ped resuscitation, adult resuscitation, trauma resuscitation. So there are 40 MCQs from here. SLO4, this is the trauma patient. Okay. So that includes 30 MCQs. SLO5, pediatric emergency, that include 25 MCQs. Procedure skill, that are 10 MCQs. Complex and challenging situation like it depends, non-accidental injury, patient coming with the HIV exposure, needle stick injury, person who was drunk, he is having children. So that's the complex challenging situation. There would be 15 MCQs from there. I'm audible? Okay. Okay, how much time you need for the MRCEM SPA? At least 6 months. Don't go for MRCEM SPA. Okay, if you don't have prepare for 6 months. People will say that I have passed in 3 months, I passed. But that's also depend on person to person. So there would be a very few people who has passed MRCEM SPA in 2 months or 3 months. If you will ask me, when we were preparing, we also prepared in 9 months, but we were giving 14 to 16 hour daily. So that depends. That's why if I say to you, I passed in 3 months. So that would not be fair with you. You will go for exam, you will fail it. So that depends on the person. It varies from person to person. How much time you are giving on daily basis. You have family commitment, you have job commitments. So if the person who has passed the exam in 2 months, was he doing any job? Was he has any family commitments? No. When I
I prepared an exam. I was just preparing for exam. Okay, I got the leaves. I prepared for it for 60 days. So I will also recommend if you are going for MRCM primary, at least get 15 days leave. If you are going for MRCM SPA, at least get 30-day leaves. From morning till night, you must study. Only study, study, study. Then you are going to pass it before exam. Okay, so you must give at least 6 months. At least 6 months to this exam, then you are going to pass it. What should be your strategy in these 6 months? That I am going to tell you. So you can see that there are SLO1, there are about, you can see allergy, cardiology, derma, ENT, eye, endo, hema, mental, nephro, neuro, pain, respiratory, sexual. So there are 22 topics. About 22 topics in SL1, and you are going to have 60 MCQs. 22 divided by 60, at least 2 to 3 each. Okay, so that's and this syllabus is approximately 60% of all syllabus of MRCP. So you are getting from 60% syllabus 60 MCQs. But if you will come to here, resuscitation. So there are 40 MCQs in resuscitation that includes ATLS, adult trauma resuscitation, ped resuscitation, adult resuscitation. So there are 40 MCQs. And then if you will come here, injured patient, orthopedic trauma and major trauma, there are 30 MCQs. And here procedure skill, there are only 10 topics. Each topic you will get 1 MCQ or any one of them. So you will get 10 MCQs total from SLO6. Chest strain, external pacing, fracture dislocation, lumbar puncture. Pain and sedation, focus, vascular access, wound management. So you can see out of these topics you will get 10. So there are few topics for these 10 MCQs in the procedure skill. So I divide this syllabus like resuscitation, trauma plus procedure skill. So these are 80 MCQs from these 3 topics. Like I have told about that how you should follow the MRCM program. So there are 80 MCQs from these 3 topics. And they are about 40% of the all syllabus for MRCM SP or 30%. Okay. So if you do the smart study, you focus on these 3 topics like procedure skill, resuscitation, trauma, and simultaneously, and you are studying daily these resuscitation, trauma, and procedure skill, and 2 days you give on 2 days 1 topic each to SLO1. When you will finish in 1 month or 2 months, you will finish trauma and procedure skills and resuscitation, then you will finish half of the SLO1. So that's how 10 topics have been covered. So then you will start again trauma, resuscitation, and procedure skill. So in 3 months, you will completely revise 1 time all syllabus of the MRCM SBA. So in these 3 months, you will revise trauma and resuscitation 2 times and SLO1 and PEDS. Okay, PEDS, all of the syllabus that is in SLO1, that is also include the PEDS patient. Like they can give the PEDS ENT patient tonsillitis for PEDS age. They can give the group for the PEDS age. So you have to follow this. So in 3 months, you must make notes. I will tell you from where what you should study. Okay, what the resources you must follow. So that should be your plan. I have given the plan for 6 months who are going for January exam. Who are going for January exam, they must follow it. Okay, January next year 2026 exam. So That was the strategy. MRCM SBA 1 mark. There are no negative marking. Okay, and average passing mark more 120, but from last few years it's more than 115, 117, 118. So your target should be 120 plus. Passing rate for MRCM SBA is one of the lowest among all RCM exam, that is 47%. Okay, less than half of the candidate passed the exam. So in Pakistan, the passing percentage is 20 to 25%. You remember it. Okay. So this 47%, these are the people from other countries. They are passing the exam. So it is easy to pass or difficult? Yeah, if you are not following the strategy, it will become difficult. I met a person today. He has given 4 attempts, so he is going for 5th or 6th attempt. So it can become difficult for you. So that's what I have told you about the syllabus. MRCM, major trauma, orthopedic trauma, procedure skill, resuscitation. So toxi, ENT. Okay, so you must omit it. Toxi, ENT, respiratory. So all these are having 120 plus MCQs. You must focus on these topics. Okay. So where to prepare and what resources? So there is not a single resource for the MRCM SPA preparation. Always remember, you don't. If you are following PrepXpert, you're following MRCM Success, you're following OHM, you're going to fail it. Okay. So for resuscitation, I will say follow the ALS algorithm. If you have manuals, follow it. Okay. ALS algorithm, all ALS algorithm and their implementation, that should be on your fingertips. Then for trauma, you must do the trauma from OHM. I would recommend from OHM. Okay, from OHM you must go through the trauma. And for everything, resuscitation, trauma, for resuscitation you can follow the research council. For trauma, anything, you must follow the RCAM learning management plan. You must go through the RCAM learning. If you are feeling difficulty, confusing anything, you must go through. How will you get the RCAM learning? You must get the subscription of the RCAM membership. Go on Google, type the application for membership, get the membership, you will get the RCAM learning free, and on these money you will get the discount. So that's only the beneficial to get the membership of RCAM. From OHM, you can read out all OHM, but there are some topics, their guidelines have been changed. So if anything that is conflicting between OHM, ALS algorithm, RCAM learning, so you must follow the ALS algorithm, RCAM learning, or NICE guideline. Neither any book, not American Success, neither me, neither any student, neither any teacher. You must follow the ALS algorithm, you must follow the RCAM learning, you must follow the NICE guideline. So that you must follow. So I have told you from resuscitation, trauma, where you should study. For trauma, you must go through the OHM. Everything you will know how to deal with the patient, and then how to pick up the MCQ, how the patient is coming in the emergency department, what should be your approach. For resuscitation, ALS algorithm. Okay, so other thing, for resuscitation, then you must know that how to pick the MCQs. I will tell you that what you should study for picking out the MCQs. So trauma, resuscitation, I have told you. For procedure skill, you can also go to the OHM, or for procedure skill, you can follow the PrepXpert file. That's also enough. And you can also follow the RCAM learning, all of the procedures. Wound management, focus, you can go to the RCAM learning, you make your own notes. SL1, that's written good in MRCM Success. So for SL1, like allergy, anything that IENT, so you can follow the MRCM Success plus OHM together. Okay. IE is written good in OHM, ENT is written good in OHM, PEDS section that is written at the end, that is written very well in the OHM. Okay, so then the expert quizzes.
these are offline. You don't have to waste the $150 on it. You have all the quizzes offline. So when you are doing the quizzes, so that MCQ is not important. Past recalls for whenever you are doing past recall for MRCEM primary or MRCEM intermediate. So this topic is important. Like if you have get any MCQs, I say from anterior shoulder dislocation, you get the X-ray. This time they can give anything related to anterior shoulder dislocation. If you have gained any top MCQs from group, so they will not ask same question. They can give any question related to group. So you must go through the topic. These are the important topics. So that's why I am also conducting topic-based sessions in MRCEM Masters. So that's why we are going for MRCEM number. So that's how I made that we should focus on the topic. So that's very important, not the MCQs or recall. So that's this topic from where the recall, you know the recall. So that topic is very important. And for SLO7, you don't have to waste time to understanding it. You can give or you can go for it last month. So I was telling you have given 3 months, one revision. So in next 3 months, other 2 months, one revision, and then 1 month, you must, first 3 months, you must read the theory. You can go through the MCQs, anything, you will get the idea. But then for next 2 months, 1 month, you must prepare any MCQs from here. You can make your own MCQs. So that's how you must prepare for it. At least 3 to 4 revision. 4 revision you must give to all the syllabus of MRCEM SBA, and it's not an easy syllabus. Okay, so other thing that's important, I want to show you. Yeah, this one. This table you must know about in the MRCEM SP exam. You will confuse what's the abnormality assessment, these wording, what are the meaning of these words, class of drug, characteristic, these about it, definitive management. So that depends that how the question is being asked. Are they are asking about definitive management, either they are asking about immediate management, ED management, essential thing, or they are asking about features, immediate. So these are the terms you must know. Immediate mean what you are going to do now. Like I always give the example that there is a feature given on tension pneumothorax, and you have diagnosed, you have given the X-ray and you have diagnosed that patient is having deviated of trachea deviated. There is a right-sided tension pneumothorax, and they have asked the question, what is the definitive management? Then your answer should be different. If they are asked what is immediate management, then your answer should be different. And like if they have given Smith fracture, they can ask what is your next step. So you are going to make the patient pain free and you are going to apply back slab, everything. They can ask about what should be definitive treatment or what you are going to do. So they can also ask about that you are going to refer it or that orthopedic involvement. So that's how the question can be asked. Okay. So these glossary, this is very important. Okay, you must go through it. These are the abbreviation. You can get the abbreviation. This is also on the website of MRCEM. So that's all about MRCEM and SBA. So we are conducting 6-month course on MRCEM expert, prep expert. Okay, so that's we will revise about 3 times the course during these 6 months. Any question you can ask. Do you have any question?
Sir, I have one question. Actually, you told about that after MRCEM SBA, there is a chance to get sponsorship. Is it for like international doctor, or like if somebody is already in UK, does they can apply for it?
Anyone, if you are in a UK, you will have if you are in a UK, okay, and your any husband is working there, most of the time if doctors were female, their husband or the male who wives are working, but they are not working, they have passed American planning. So you can get, it depends on your connection. My friend, he got recently the GMC, okay. His wife got the job in UK. They went there after a month, and she talked with the consultant. Her consultant talked with the emergency consultant. So they arranged the interview. After interview, they liked their CV and everything, and interview they succeeded. So they have given the job, and with MRCEM primary and intermediate, and they have given 2 months temporary GMC. They have asked the GMC to sponsor for NHS. So that depends. If you are in UK, you have a great chance to secure the job on, but that depends that how your connections work. All depends on your connection.
Yeah, thank you very much, because I'm already in UK, and if I pass the SBA, I will try, but don't know how to do it. That's why I was asking.
Yeah, it depends. You can get my number if you are in a group. I don't know from where did you get the link. So you can have a chance to secure the job. I will tell you that how should you follow it. Okay.
Thank you very much,
Okay. Any
sir.
other question? Any other question? Course is starting. We are conducting sections for. You can connect if you have my number. Can take it if anyone wants to connect. WhatsApp. Okay. Okay, we have started already connecting sections for MRCEM September diet. So if you will join now, you will get the September diet session. Then we will start for January. So you will have you will get 5 to 6 revision. Okay, if you are going for September diet, then we are conducting crash course, so that you can also join that. I'm conducting crash course. So that's any question. Either we are going to end this session. So these are my Dr. Aksa, I know, Amna, I know, Huma, I know, Anam, Aruna, Imad, iPhone, Nihal. These are new. Okay, good. Okay, Allah Hafiz. Thank you very much.